WCIA 3 News at 10.
Whatever happens with Dobbs, if Roe falls, Illinois is still going to continue being a magnet state for abortions.
Anti-abortion groups wasted no time fighting.
It's been more than a year since the Dobbs decision in the overturning of Roe versus Wade changed the course of abortion access across the country, and the outcome is exactly what some experts didn't expect. Good evening, I'm Brendan Morano.
And I'm Karina Rubio. Some states banned the procedure while others opened its borders for people seeking care. Illinois was one of them, and Planned Parenthood Illinois says the numbers have gone up significantly. WCIA3's Ariana Williams is with us. Ariana, how big of a jump is this?
Planned Parenthood reported a 54% increase in abortions since overturning Roe versus Wade, and a 700% increase in traveling from outside of state.
And I think a lot of that comes from fear. You enter a really crisis mindset, and when you're scared, it's like I want to get out of that as quickly as possible.
Indiana, Kentucky, Missouri, and Iowa are just some of the states that banned abortion to some extent, and they all happen to neighbor Illinois, a state where the law hasn't changed at all.
We really saw an influx. Those patients still needed that care, and Planned Parenthood of Illinois Health Centers were here to absorb that additional patient load and provide the care that so many people from these other states needed.
People are always going to need and seek out abortion services, regardless of how difficult those services might be to acquire.
Even as difficult as crossing state lines to do it. Anna Kinski with We Dignify, a pro-life group at the U of I, says they fear these increased numbers are sending the wrong message about the state.
As a woman and as a mother, it breaks my heart to know that Illinois, in the pursuit of opening up our borders for abortion, has sacrificed women's health in the process.
Pro-choice supporters like the Planned Parenthood and Equity Clinic in Champaign don't see it as sending the wrong message. They view it as providing a needed service.
It's unfortunate that we have to continue to go out of our way to support patients from other states as they navigate some very difficult terrain.
He says regardless of which side of the fence you're on, the best measure is to talk with someone in your community.
I really truly believe as a pro-life movement that loving a woman and giving her the support that she needs financially but also socially is so important.
Once you hear the stories of people who are close to you and you understand that this is a normal part of healthcare and a normal part of many people's life journey, it becomes a little bit easier to understand the
Both groups plan to match the increase with abortion by increasing their respective services. They will continue to provide assistance and education to women who seek their assistance. In the newsroom, Ariana Williams with WCIA3, your local news leader.
Ariana, thank you. Since the Dobbs decision, patients traveling from 29 states now make up 85% of all abortion appointments. Planned Parenthood announced the first mobile abortion clinic, and vasectomy appointments went up by 97%.